What is an issue that goes unnoticed although it ends in the death of thousands of people yearly? Mental health is a major concern that affects around 1 in 7 teenagers globally. Although it is a common issue, in many schools it remains hidden and disregarded with silence and stigma. This is why we chose health and well-being as our Global Perspectives project to study the problematic at hand. At Gimnasio Colombo Británico, or GCB, we decided to explore how the limited awareness and support that currently exists within our community impacts student well-being and which actions can we take to change this. My name is Sara Rincon and I coordinated the final report and video design.
My name is Garcia and I analyze the data and support the research process.
My name is Emanuel Pardo, and I collected the data that later helped us shape the share of our findings.
My name is Samuel Tautiva, and I investigated causes, effects, conclusions, and more through global and national perspectives.
The problematic addressed is the insufficient access to knowledge to mental health support among the students, and how these issues impact their lives in various aspects. In many schools, mental health is stigmatized and misunderstood. This causes students to feel isolated or afraid to speak about their emotions, preventing the detection of psychological difficulties.
The analysis of a student well-being survey conducted at GCB reveals that around 72% of students said that they feel stressed or anxious on a weekly basis. Finally, 54% reported that they would prefer to talk to another student before approaching a teacher or adult about emotional problems, while a 43% said they don't feel comfortable discussing mental health due to stigma or fear of being judged. Locally, this lack of support and knowledge manifests as decreased academic motivation and concentration, social withdrawal, and difficulty maintaining friendships, increased irritability, anxiety, or sadness, and reluctance to seek professional help due to stigma.
The lack of understanding and support for mental health is also a global challenge. According to a study made by the World Health Organization, 1 out of 7 teens from 10 to 19 years old experiences a mental health condition. Suicide is the fourth leading cause of death among adolescents aged 15 to 19 years old, and 75% of all mental health disorders begin before the age of 24. Yet, most remain untreated due to stigma and lack of resources.
The GCB case is an example of the global adolescent mental health crisis. Factors such as fear of judgment and stigma, limited access to safe spaces or trusted individuals, and insufficient education about emotional regulation keep affecting us as students. The Mind Matters project provides a locally driven response to a global problem, allowing there to be a bridge constructed between awareness and action.
The impact of these efforts is visible across regions. Programs that train teachers, such as MindEd, have led to efficient support and stronger collaboration with counselors in Europe. The CEL INI in Japan has improved classroom coexistence and social skills among teenagers in East Asia. Finally, initiatives like the campaigns made by Save the Children have increased awareness of emotional well-being and encouraged open conversations about mental health in schools of Latin America. Constructing a community approach. These examples demonstrated that effective school-based interventions adapt to cultural and systematic contexts but share the same goal, creating safer, more empathic, and educational spaces for young people.
Globally, major organizations are also leading coordinating efforts. The World Health Organization encourages integrating mental health in school systems as a section of its comprehensive school health model that focuses on early detection and prevention. UNICEF supports child-friendly mental health programs and works to ensure psychological support is accessible in education settings, especially in low-resource areas. UNESCO encourages an inclusive approach to well-being which promotes teacher training, emotional education, and safe school environments. Together, these global initiatives aim to make mental health care a normal part of education not an exception.
GCB can become part of this international movement by implementing its own approach. Through the Mind Matters Club, the Mental Health Ambassadors Program, and artistic therapy sessions, students at the school will contribute to the same global mission of reducing stigma, promoting awareness, and strengthening support within the learning community. These local actions make the school an active participant in the worldwide effort to protect young people's mental health.
According to UNICEF, teenagers are often more open with other classmates than with adults when going through emotional struggles. This highlights the relevance of initiatives like the Mental Health Ambassadors Program, where trained students serve as points of support that students can go to. By advocating for open communication with classmates, the initiative helps normalize mental health talks and reduce the stigma that prevents many young people from seeking help. The improvement on a student's emotional health has led to a higher overall well-being and academic success globally.
Research from the OECD also supports the involvement of well-being into school contexts. Studies have shown that schools that make mental health education, emotional learning, and activities based on empathy a priority have higher levels of students' engagement and belonging. When students see that their emotional well-being is valued as much as their academic performance, they feel more connected to their school community and more motivated to participate.
The World Health Organization and the Center on the Developing Child of Harvard also highlighted the significance of early emotional support in preventing mental health issues on the long term. Their conducted researches show that when schools apply support, emotional education, and access to professional counseling, they are able to reduce rates of anxiety and depression among teens. These findings directly align with the goals of this project, which are to create a system at GCB where emotional well-being is treated as a shared responsibility.
Educational expert Dr. Catherine Ware of the University of Southampton stated that schools that actively promote emotional well-being tend to have higher academic performance and lower rates of bullying and absenteeism. This declaration reinforces that caring for mental health is an integral part of creating successful and compassionate learning communities. Through initiatives such as the Mind Matters Club, artistic therapy sessions, and mental health ambassadors, GCB joins a global effort made by schools committed to shaping emotionally intelligent and resilient children.
A vast amount of students at GCB experience anxiety or low self-esteem but don't reach out for help, partly because they fear judgment or don't know where to go to for help and advice. We realized that to build a healthier environment, awareness and empathy must start with us. After analyzing a study conducted, it could be concluded that around 60% of students do not do anything when they feel overwhelmed and emotionally exhausted.
Furthermore, more than 70% of students reported that they often feel scared or uncomfortable when expressing their emotions as they have a fear of being judged or misunderstood. Students feel like their mental health is constantly compromised due to external factors. Yet, around 50% of them are not able to recognize, express, and cope with their emotions, which has an incredibly negative toll on their mental health.
To address the problematics related to emotional struggles, lack of awareness, and limited access to mental health support within the school, we constructed a project to improve the situation at this institution. This initiative combines the Mind Matters Club, the Mental Health Ambassadors Program, and the artistic therapy sessions to create an effective program. Each section responds to a specific need within the school community, which will be education, support, and emotional expression. The Mind Matters Club works as a creative and educational hub where students can freely discuss mental health topics, organize campaigns, and create awareness materials that promote understanding and empathy. It encourages open dialogue and positions emotional well-being as a shared responsibility within the school. The Mental Health Ambassadors Program trains students to serve as approachable leaders that can identify early signs of emotional distress and guide peers toward professional support. This peer-based system not only strengthens student relationships, but also creates a bridge between the school community and its counseling department. Finally, the artistic therapy sessions use creative expression through art, music, and theater as tools for emotional regulation. These sessions allow students to express complex feelings in a safe environment, reduce stress, and build self-confidence. Together, these three strategies form a holistic structure that promotes awareness, prevention, and emotional growth.
This initiative is constructed on the belief that meaningful change begins with small, individual actions. Simple steps that include listening without judgment, demonstrating empathy towards others, and spreading accurate information can impact a person's well-being more than we might believe. By giving students the knowledge and tools to act compassionately, the project focuses on how everyone has the ability and responsibility to make a difference. Each situation that involves understanding or support contributes to creating a more inclusive, caring school culture. When individual acts of kindness multiply, they transform the emotional climate of the entire community.
Mental health cannot be improved in isolation. It requires collaboration and shared purpose. For this reason, the project involves the entire school community through awareness, campaigns, and discussions led by students. This joint activity helps break stigma and normalize conversations around emotional health. By involving teachers, counselors, and students together, the initiative strengthens relationships and builds a sense of belonging. And stops being a topic that is discussed occasionally.
Hola, estamos con Sonia del Departamento de Psicología. Y ¿tú cómo crees que la salud mental afecta a los estudiantes y a los profesores acá en el GCB?
Bueno, lo primero es pues que la salud mental la necesitamos todos, estemos en este contexto o en otro, ¿cierto? Eso nos permite operar con una mentalidad, con un cerebro que esté dispuesto como a atender a todas las situaciones del día, a que emocionalmente también estemos dispuestos a resolver lo que sucede. Entonces, en este contexto en el que sí creo que los niveles de estrés son bastante altos, eso nos puede llevar a estar irritables, sensibles, a que sintamos que a veces no podemos hacer todo lo que nos corresponde, a que más fácilmente entremos en conflicto. Creo que también afecta en la medida en que podemos estar también más ansiosos o más tristes, entonces cualquier resultado que no cumpla con las expectativas que tenemos o con las expectativas que tienen de nosotros, pues también va a generar estos dos estados particularmente. Aquí usualmente también tanto estudiantes como profesores se sienten evaluados constantemente y bajo un estado de salud mental que no soy tan funcional, pues que me estén evaluando va a afectar mucho más mi proceder, las decisiones que tome, las formas en que me desempeñe, por lo cual pues es altamente sensible en este contexto.
Gracias, Miss.
Hi, we are here with Miss Anna, English teacher, and Miss, what do you think of how can mental health could affect teachers and students at GCB?
I think that it affects us in the way that we cannot work well. You know, we cannot function, we cannot even communicate well. Yes, when you are not okay mentally, nothing will work for you.
Thank you, Miss.
Throughout this project, we learned that actual awareness begins with empathy and the genuine willingness to understand others. Sometimes, the most powerful thing we can do is simply listen without judgment. By encouraging education, open conversations, and timely action, we can transform silence into strength and fear into connection. We learned that mental health is not a weakness, but an essential element of who we are as it shapes how we think, learn, and relate with others. This project serves as a reminder on how caring for mental health goes beyond helping individuals. Caring for mental health is about building a compassionate and inclusive community where everyone knows that they belong. Working together taught us that even the smallest local actions can have a global impact, helping to reduce stigma, inequality, and emotional neglect. By creating a culture of empathy and support within our school, we have joined a movement that seeks to protect the well-being of young people everywhere. Our final goal is simple yet powerful. It is to make mental health a priority, to care for ourselves and for others, and to help create a world where every voice is heard, every story matters, and every mind feels valued.